Question 1. The nurse will be present during a client's treatment session of electroconvulsive therapy, ECT. What is the most important goal during the procedure? C. Maintain a patent airway. According to the American Psychiatric Association, electroconvulsive therapy, ECT, is a medical treatment most commonly used in patients with severe major depression or bipolar disorder that has not responded to other treatments. ECT involves a brief electrical stimulation of the brain while the patient is under anesthesia. Informed consent is required. At the time of each treatment, a patient is given general anesthesia and a muscle relaxant, and electrodes are attached to the scalp at precise locations. The patient's brain is stimulated with a brief controlled series of electrical pulses. This causes a seizure within the brain that lasts for approximately a minute. The patient is asleep for the procedure and awakens after 5 to 10 minutes, much as from minor surgery. Question 2. The children of a patient diagnosed with Alzheimer's disease, AD, tell the healthcare provider, "Our mother seems better during the day, but she gets very confused and agitated in the late afternoon and evenings." How should the healthcare provider document the patient's behavior? B. Sundowning. This patient is experiencing sundowning or sundowner syndrome, also called late-day confusion, a phenomenon prevalent in patients diagnosed with dementia. Sundowning may be associated with impaired circadian rhythms, impaired cognition, and environmental or social factors. The patient may also start pacing or wandering, or become aggressive. Question 3. A patient is admitted to the mental health unit with a diagnosis of vascular dementia. Which of the following describes the brain alteration involved in this disorder? C. Hypoxic damage to brain tissue. Vascular dementia is characterized by a progressive worsening of cognitive function, caused by vascular disease within the brain. Decreased blood flow and tissue hypoxia are often secondary to cerebrovascular disease. Patients diagnosed with vascular dementia will have additional physical health problems that are associated with the dementia. Vascular dementia does not involve the accumulation of abnormal proteins within the brain. Question 4. The nurse in a mental health unit is caring for a 15-year-old who was admitted after a suicide attempt. Which of the following factors is most likely to contribute to an adolescent's risk of suicide? A. Peer pressure and bullying. Adolescents may attempt suicide for many reasons. Erikson's theory of psychosocial development puts teens in the identity versus role confusion stage. Peer pressure and bullying can affect this stage. According to the CDC, youth who report any involvement with bullying behavior are more likely to report high levels of suicide-related behavior than youth who do not report any involvement with bullying behavior. The other answer options are also risk factors for teen suicide but not as reliable as peer pressure and bullying. Question 5. A patient who was diagnosed with bipolar disorder is prescribed lithium carbonate, Lithobid. When teaching the patient about the medication, the healthcare provider should be sure to mention which of the following statements. C. Drink lots of fluids, especially if you are active during hot weather. Lithium increases urine output and antagonizes the effects of antidiuretic hormone. To avoid dehydration, patients should be instructed to drink 10 to 12 glasses of water each day. Additional fluids will be needed during strenuous activity, in hot weather, or in case of fluid loss caused by vomiting or diarrhea. If sodium levels are low, the kidneys will retain lithium, which may result in toxicity. Question 6. The nurse approaches a client with a diagnosis of depression, but the client says, "Leave me alone. Go find someone else to talk to." Which is the nurse's best response? A. I'm interested in learning about you. The nurse should let the client know that the nurse is interested only in the client at that moment and that the client is worthwhile and deserves full attention. Talking to others later dismisses the client's need to feel valued. Stating the client is an assignment sounds like it's an obligation for the nurse. Saying the client is smart and should speak does not match the client's sense of self-esteem at this time. Question 7. A newly admitted patient's medication orders include donepal hydrochloride, Aricept. The nurse knows that this medication is prescribed for which of the following? C. Alzheimer's disease. Donepal hydrochloride is prescribed for mild to moderate Alzheimer's disease. Cholinergic drugs, also called parasympathomimetic drugs, work by increasing the concentration of acetylcholine. Acetylcholine relays messages between nerve cells in the brain. In Alzheimer's disease, there is also destruction of nerve cells that use acetylcholine. Decreased acetylcholine levels and progressive loss of nerve cells are linked to worsening symptoms. The drug can slow the progression of the disease but not reverse it. Question 8. Which of the following methods of completing suicide has the greatest risk of lethality? C. Self-inflicted gunshot wound. According to the Harvard School of Public Health, completion of suicide is related to several factors. 1. Inherent deadliness. Firearms have the highest risk, overdose much less risk. 2. Ease of use. The method does not require technical knowledge. 3. Accessibility. A gun in the drawer is easier to access than a bridge 3 miles away. 4. Ability to stop during the attempt. If the attempt can be interrupted, there is an opportunity for rescue. In order of risk, these options are: 1. Self-inflicted gunshot wound. 2. Suffocation by hanging. 3. Jumping from a high bridge. 4. Overdose by drug or poison. Question 9. As the oncology nurse prepares to administer chemotherapy to a client with newly diagnosed cancer, the client says, "Everyone who gets cancer dies. I don't know why we're bothering with this." What is the nurse's best response? B. You're worried that you might die. The nurse should allow clients to express their feelings. In this case, the client is afraid that their cancer will be fatal. By stating the client's fear directly, the nurse allows the client to continue. The other options avoid the client's feelings and are disrespectful of the client's situation. Question 10. When assessing a patient with severe depression, which of the following would the healthcare provider identify as a cognitive alteration? A. Somatic delusions. Patients diagnosed with depression may experience cognitive, affective, behavioral, or physiological alterations. A somatic delusion, the false belief that the patient has some physical defect or disease, is a cognitive alteration associated with depression. For example, the patient might think that they have an internal parasite. The other choices are affective alterations. Question 11. A client with a diagnosis of bipolar, manic phase, was started 6 days ago on lithium carbonate 300 mg p.o.tid. What is the best time for the nurse to plan for a serum lithium level blood draw on day 7? A. In the morning, before breakfast. The serum lithium level should be drawn in the morning, before the client has breakfast. The most accurate serum lithium concentration is before the first dose of the day is given, because it peaks 1 to 3 hours after ingestion. The therapeutic range is 0.8 to 1.2 mEqL. Question 12. As part of the administration of a mini-mental status exam, MMSE, the healthcare provider asks the patient to copy a simple geometric shape. This part of the exam tests which of the following mental functions? C. Visual comprehension and praxis. The mini-mental status exam, MMSE, screens for cognitive loss by testing the patient's orientation, attention, calculation, comprehension, recall, language, and motor skills. The healthcare provider will observe how well the patient copies the shape. Copying the shape successfully demonstrates visual comprehension and the ability to plan and execute coordinated movement, praxis. The MMSE is used to screen for dementia. Question 13. A client presents to the emergency department with an injured hand that turns out to be fractured. The client tells the nurse that rather than hit their spouse during an argument, they punched a brick wall. What defense mechanism did the client use? A. Displacement. Displacement is a defense mechanism that involves an individual transferring negative feelings from one person or thing to another. The classic example is someone who gets yelled at by their boss, then goes home and kicks the dog. Frequent displacement can lead to difficult relationships and/or substance abuse. Projection is putting or accusing one's behaviors and faults on someone else. Regression is returning to behaviors from an earlier life stage. Avoidance is staying away from people, places, or situations associated with uncomfortable thoughts or feelings. Question 14. When the nurse enters a client's room, the client states, "I asked that aide girl for a cup of tea 10 minutes ago. She's ignoring me." What is the nurse's best response? A. I can see you're frustrated. Let's talk a minute. The NBSB, best and NBSB, response from the nurse acknowledges the client's verbalized needs and encourages an open conversation. Asking a why question is not therapeutic, because it doesn't validate the client's feelings. To apologize and not acknowledge the client's feelings is inappropriate. It is rude for the nurse to tell a client to be patient or assert that the client's request can wait. Question 15. A psychiatric client tells the nurse that he hears voices telling him he must leave the hospital and kill his family. The nurse's best response is, B. I know the voices seem real to you, but I want you to know I don't hear them. The nurse should validate the client's experience, as well as state the reality. Do not minimize or dismiss what the client is experiencing. Do not threaten the client. Question 16. A patient diagnosed with major depressive disorder is admitted for inpatient care. Which of the following is the primary goal during the admission assessment? B. Collecting and organizing patient data. The primary goal during the admission assessment is to collect and organize objective and subjective data so that patient problems and needs can be identified. Goals and outcomes are based on patient problems that have been identified. Medication may be part of the treatment plan, but it is not a primary goal. Question 17. A client who started venlafaxine, Effexor, 75 mg POQD calls the mental health clinic after a week. The client tells the nurse, "This isn't working. I'm still depressed." What is the nurse's best response? A. It takes up to 4 weeks to have full effect. A client on antidepressant therapy needs to be informed that although they may feel somewhat better in 1 to 2 weeks, it can take up to 4 weeks to notice a significant improvement in symptoms. Providing accurate information helps the client feel less anxious and maintains compliance with the medication. Telling the client to call back in a few days is not realistic in terms of the length of time needed for the medication to take full effect. Changing a dosage or trying a different medication are not yet appropriate until it can be determined whether this medication is effective. Question 18. While the nurse is passing medications in a long-term care facility, one of the clients states, "I need help with even the simplest things now. What's the point of living when I can't do anything for myself?" What is the nurse's best response? A. You sound discouraged today. Do you feel like talking about it? The nurse should allow the client to talk more about why they feel discouraged. Loss of independence is a major blow for most people and should be acknowledged. The other options are falsely reassuring, judgmental, or an attempt to distract the client. Question 19. A patient diagnosed with delirium sees the intravenous 4 tubing and believes it to be a snake. How should the healthcare provider document this behavior? C. Illusion. The patient is experiencing an illusion, which is the misinterpretation of a real stimulus. A hallucination is a false sensory perception not associated with a real stimulus. A delusion is a false personal belief that is maintained in spite of evidence to the contrary. A patient who is confused would not believe the 4 tubing was a snake. Question 20. A 19-year-old female presents to the emergency department, stating she was raped at a college party. After providing treatment and preserving evidence, what is the nurse's first intervention? B. Obtain consent to contact others who can provide the client with safe shelter. Following medical treatment and preservation of evidence, the nurse should provide support and assist in finding a safe shelter for the client. The other answer options are valid and part of the client's future actions, but they are not the immediate priority. Question 21. Following a suicide attempt by hanging, a client is admitted to the psychiatric unit. Which action by the nurse is most important in maintaining client safety? A. Assign a staff member to stay with the client at all times. A suicide attempt by hanging or gunshot is serious. Client safety is the top priority, requiring constant observation. Other clients have no responsibility in this client's care. Removing clothing is not adequate to provide client safety. Seclusion is isolating, punitive, and not therapeutic. Question 22. Which of the following assessment findings in a patient's health history supports a diagnosis of substance dependence? C. Withdrawal symptoms when not using the substance. Substance dependence is characterized by the need to continually use the substance to avoid unpleasant physical symptoms of withdrawal, physical dependence, often accompanied by an intense craving for the substance, psychological dependence. Problems related to substance use tend to become more serious with repeated use. Withdrawal symptoms demonstrate a physical finding. The other three answer choices are behavior-related. Question 23. A patient diagnosed with depression is prescribed a monoamine oxidase inhibitor, MAOI. When teaching the patient about the medication, which statement made by the patient would indicate a need for additional teaching? C. I don't have to limit the pepperoni on my pizza. The patient will need to avoid consuming foods that are high in tyramine. Processed meats such as pepperoni are high in tyramine. Combining tyramine-rich foods with a monoamine oxidase inhibitor, MAOI, can result in a hypertensive crisis. Other foods to avoid are cheese, yogurt, alcohol, fermented foods, sauerkraut, kimchi, soy sauce, and some fruits and vegetables. Question 24. A client with chronic kidney disease, CKD, learns that her condition has progressed and she now requires hemodialysis. She becomes angry and tells the nurse, "My life is ruined. Nothing will ever be the same." The nurse understands that the client's statement is related to C. Grief because of the physical and lifestyle changes. Clients with chronic disease or conditions that require changes in appearance, physical health, or lifestyle undergo a grief process for the loss of their former lives, similar to the death of a loved one. The client may also have an altered body image due to the impact of hemodialysis. Question 25. A male client with a diagnosis of paranoid schizophrenia is admitted to the inpatient mental health unit. The client tells the nurse that he hears God telling him that he is a sinner and must punish himself. Which is the nurse's most appropriate response? B. Please tell us when you need to punish yourself. The first thing the nurse should do is ask this client about his current intention to follow the auditory hallucinations and inflict self-harm. After that, determining the method of self-punishment is important. The nurse should try to find out more about the client's sins. Finally, Discussing the client's potential and strengths can help change the client's feelings of worthlessness. Question 26. The pediatric nurse is providing preoperative care for a 7-year-old child. The child is crying, anxious, and unwilling to cooperate with requests. Which of the following statements by the nurse is most therapeutic? B. Let's get your superhero doll ready for surgery. 2. Preoperative anxiety occurs in up to 75% of children. By including a toy, either one of the child's favorites or a new one, the nurse can involve the child and their toy in the preoperative process. Depending on the age of the child, the toy can be included in the process. The child can teach the toy about surgery, and/or provide a pleasant distraction. Parental stress is also reduced when their child's anxiety level is decreased. Asking the child to share their feelings at this moment is not the best action. Promising something in the future does not reduce current anxiety. Threatening the child is totally inappropriate. Question 27. A client with bipolar disorder, manic phase, says to the nurse, "Hey, beautiful. You're sure looking pretty today." Which is the nurse's best response? A. I'm Tina, the nurse for this shift. The nurse should establish her identity and purpose, so the client has no confusion. Condoning or punishing the behavior are not therapeutic responses and do not establish limits. Question 28. A client on the inpatient mental health unit approaches the nurse and says, "I can't stand that smell of decaying flesh. Can you do something about it?" The nurse understands that the client is experiencing AN. B. Hallucination. A hallucination involves the senses and feels real but is not. It can be seen, heard, felt, or smelled. Examples are smelling an odor for which there is no explanation, hearing voices or sounds that aren't there, like footsteps, seeing lights or patterns, or having a sensation of floating outside one's body. A delusion is a false belief that persists in spite of evidence. A flashback is reliving a vivid or traumatic experience. Withdrawal is a mental and physical condition that occurs after stopping a drug. Question 29. During a discussion group in the psychiatric unit, a female client suddenly becomes upset and leaves the group, yelling, "Everyone here hates me." What should the nurse do? C. After group, approach the client to talk about her feelings. It is most therapeutic to talk with this client privately about her feelings, after discussion group. A suspicious client is not likely to share her feelings in a group setting. Discussing any client's situation with another client constitutes a violation of the client's privacy. The other clients have no reason to apologize. Question 30. A patient has been diagnosed with agoraphobia. Which of the following would the healthcare provider identify as a characteristic of this disorder? D. Fears to use public transportation. Agoraphobia is a type of anxiety disorder in which the patient fears situations that make them feel trapped, helpless, or embarrassed. The patient fears an actual or even an anticipated situation. Examples of agoraphobic situations are being outside of the home alone, being in a crowd, and being aboard a bus, train, or some other form of public transportation. Refusing to use a public restroom is a sign of a social phobia. Xenophobia is a fear of strangers, and coulrophobia is a fear of clowns. Question 31. A patient diagnosed with obsessive-compulsive disorder, OCD, continually carries a toothbrush and will brush and floss up to 50 times each day. The healthcare provider understands that the patient's behavior is an attempt to D. Relieve anxiety. OCD is an anxiety disorder identified by unwanted thoughts that the patient attempts to control by repeating actions that are excessive and interfere with the patient's normal routine. This patient's continual brushing and flossing are the result of persistent thoughts that compel the patient to perform the ritual to get temporary relief. The ritualistic behavior, brushing and flossing the teeth, is a compulsion that is performed in an attempt to provide relief from anxiety-provoking obsessions. Question 32. When a 5-year-old child is hospitalized, the nurse encourages the parents to bring in some of the child's favorite toys. The purpose of this is to D. Minimize separation anxiety during the stay. The purpose of providing familiar items is to reduce separation anxiety when the parents can't be present. The purpose of having toys or objects from the child's home is not to reduce the spread of pathogens. Familiar objects do not create a trusting relationship or help the child remain calm during a procedure. Question 33. A nurse is caring for an elderly Vietnamese patient in the terminal stages of lung cancer. Many family members are in the room around the clock, performing unusual rituals and bringing ethnic foods. Which of the following actions should the nurse take? D. If possible, keep the other bed in the room unassigned to provide privacy and comfort to the family. When a family member is dying, it is most helpful for the nursing staff to provide a culturally sensitive environment to the degree possible within the hospital routine. In the Vietnamese culture, it is important that the dying be surrounded by loved ones and not left alone. Traditional rituals and foods are thought to ease the transition to the next life. When possible, allowing the family privacy for this traditional behavior is best for them and the patient. The other 3 answers are incorrect because they create unnecessary conflict with the patient and family. Question 34. During a group therapy session, a client with heroin addiction states, "I have caused my wife and kids so much pain. I'm such a loser." What is the nurse's best response? D. Addiction is a treatable disease. Addiction, drug or alcohol dependence, is considered a treatable illness, so the nurse should offer hope. The other responses are not therapeutic, because they can increase the client's guilt and doubt. Question 35. The nurse overhears a client tell an unlicensed assistive personnel, UAP, that the client is worried about their elderly parent being alone while the client has been in the hospital. The UAP tells the client, "I'm sure your parent is doing well." What type of communication is the UAP using? D. Unwarranted reassurance. Unwarranted reassurance, also called false reassurance, is a non-therapeutic communication technique that uses clichés or comforting statements of advice as a means to reassure the clients. These responses block the fears, feelings, and other thoughts of the client. And NBSB. Examples include, "I'm sure you'll feel better soon." "Everything will be fine." "Don't worry, you're in good hands." Active listening is therapeutic and an essential part of communication. Providing leads encourages further discussion with phrases such as, "Tell me more about your concerns." Comforting validation is not a communication term. Question 36. After being robbed and beaten by an unknown assailant, a patient is diagnosed with post-traumatic stress disorder, PTSD. When developing a plan of care for the patient, which of these interventions will the healthcare provider plan to implement first? D. Promote the establishment of a trusting relationship. PTSD can develop after experiencing or witnessing a life-threatening event. PTSD is characterized by intrusive thoughts, nightmares, and flashbacks of past traumatic events, causing severe anxiety. Medication therapy and teaching effective coping skills will be part of the patient's plan of care, but these will have limited effectiveness until the patient feels safe and has a trusting relationship with the healthcare provider. Typically, the patient will avoid reminders of the trauma, so the patient should be encouraged to talk about the trauma at their own pace. Question 37. A parent brings a 3-year-old to the emergency department for a dislocated shoulder. The parent reports that the child fell down the stairs. Which of the following behaviors should raise suspicions that the child may have been abused? D. The child doesn't cry when their shoulder is touched. A characteristic behavior of abused children is the lack of crying when they undergo a painful procedure or are examined by a healthcare professional. Other signs of physical abuse include unexplained bruises, burns, bites, or black eyes, has fading bruises or other marks noticeable after an absence from school or daycare, seems frightened of the parents and protests or cries when it is time to go home, withdraws from adults. Child abuse is the third leading cause of death in children between ages 1 and 4. The other behaviors are typical for a 3-year-old. Question 38. As the emergency department nurse completes a rape kit and care for a client, the client appears calm and quiet. When the nurse asks how she feels, the client replies, "I'm fine, thanks." What is the likely cause of the client's behavior? D. The client is in denial about the rape. A common reaction to severe trauma is denial of the event. To deal with the trauma, a client may shut down emotions, claiming that they are doing well and don't need any help. While this client can't accept intervention at this time, she should be encouraged to seek help or counseling to prevent or minimize future psychological problems. Question 39. A patient is receiving care after being diagnosed with generalized anxiety disorder, GAD. Which of these statements made by the patient would indicate to the healthcare provider that the patient is beginning to show signs of improvement? D. I can tell when I'm beginning to experience anxiety. Generalized anxiety disorder, GAD, is characterized by excessive worrying that may result in problems such as hyperarousal, muscle tension, difficulty relaxing, and impaired sleep patterns. Patients diagnosed with GAD often engage in avoidance behaviors. An initial goal for the patient is to be able to recognize when symptoms of anxiety occur. Once anxiety is recognized, the patient can employ coping skills to manage the anxiety. Medications can be helpful in managing GAD, but they should be used in conjunction with cognitive behavioral therapy techniques. Question 40. Before touching a crying client to offer comfort, the nurse should consider: D. The client's cultural background. Western culture uses therapeutic touch as a way to offer support or comfort, but other religions or cultures may consider it a violation of privacy. For example, Asians or Muslims do not welcome touch by strangers or by someone of the opposite gender. When in doubt, ask for permission or be conservative in your approach.